Hello, everyone. Sorry for the delay. We're having some technical difficulties, but we're here. We're excited. I hope everyone is well, staying safe, and conspiring to keep building community, even though we have social distancing. I'm really excited to be able to share this cyberspace with you all, especially when it comes to talking about the things that we'll be talking about today. My name is Damian Cabrera. I recently joined MMAC as program manager for the treatment division. I am originally from Puerto Rico and have been part of the LGBTQ community from the standpoints of political activism, public health, and many others. And so, as we're discussing on what topics to include in this series of webinars around COVID, the first thought that came to my mind was that I believe that in media and in general, we are not talking about immigration enough. And I believe those are one of the populations that are most deeply impacted by this human crisis. And so my objective with today's webinar is precisely to keep that conversation alive and to talk about the experiences about immigration during COVID, and also to showcase what are some organizations doing, and most importantly, what can other people do to support those efforts. In the United States, there have been around 1.2 million cases and almost 75,000 deaths. These are really difficult and scary times. Many people are not only dealing with loss of loved ones, but also loneliness and sometimes even not having anything to eat, while some others have the privilege of having a safe space, being able to work from home, or just having the privilege of just staying home and surviving. Um, and we know that emergencies don't affect everyone. Emergencies and disaster do not affect everyone, all populations equally, but that instead there are countless of other intersections that come into play, such as poverty, immigration status, sexual orientation, gender identity, and many others. I am definitely not an immigration expert, but I still wanted to facilitate this conversation with those who are knowledgeable and who are experienced and who are most importantly in the forefronts. So for this panel today, we have Angel Fabian, Oscar Lopez, and Ruby Corrado. Angel Fabian is an immigrant, curanderex, two-spirit queer Chicanx activist and organizer with a 20-plus year history of progressive policy and advocacy across a range of public health settings. Angel also possesses a strong and unwavering history as a Latinx HIV/AIDS and immigrant rights advocate, and is currently the advocate coordinator for #FíjateBien, a program by Impact Global Action for Gay Men's Health and Rights. Oscar Lopez is the CEO and lead capacity building provider for Poderosos, a national advocacy and capacity building organization based on the US-Mexican border with a focus on improving the wellness of Latinx communities. Oscar Lopez has witnessed firsthand how social determinants of health impact Latinx and LGBTQIA communities. His more than 30-plus year career, training, and life experiences inform his current efforts towards social justice to improve the health outcomes and civil liberties of immigrants, people living with HIV, queer youth, and many others. Ruby Corrado is a tireless advocate and leader for social justice that has fought for LGBTQ human rights, transgender liberation, immigration equality, and access to healthcare in the DC metro area for the past 20 plus years. She has worked against hate crimes and many other disparities, achieving to gain legal protections to the communities she represents. Ruby is also the founder of Casa Ruby in 2012, the only LGBTQ bilingual and multicultural organization in the DC metro area. Casa Ruby offers a variety of services that include housing, preventive health, and immigration services, among others. Today, Casa Ruby employs almost 50 people and serves more than 6,000 people a year. So before we start, I want to encourage everyone to type their questions on their chat box. Chip, our communications director, will be reading them out loud. Again, thank you everyone for being here, for taking from your time. Welcome. Ángel Fabián, thank you for accepting our invitation, and adelante.
Muchas gracias. Good morning, good afternoon, everyone. My name is Ángel Fabián. I am the advocacy coordinator with Fíjate Bien, with Impact, Equal Action for Women's Health and Rights. I just wanted to take the moment to, I believe I can start sharing my screen. I do not see that function. Okay. So I wanted to make sure that first and foremost, I pay honor to those that came before us and those that will come after us. Specifically, I wanted to give a shout out to Omar Martinez, who is doing a lot of work around medical legal frameworks, to Puente, to Familia Trans Queer Liberation Movement, to Latinos in the South, to the Trans Latina Coalition, and to protecting our immigrant families. Because they are actually doing the on the ground work. Is there a possibility to share my screen? There we go. So this is a little about what Fíjate Bien does. We support community engagement to address barriers, structural barriers to HIV prevention services, care and treatment services, specifically focusing on Latinx gay bisexual men. We are global organizations who we establish partnerships between US advocates and global advocates, and envision to strengthen organizational capacity to ensure that access to services are made available. Why do we exist? We exist because there's still a lot of disparity with regards to HIV, how HIV looks in our respective communities. From the screen, you can see that although we are a small minority still within the US population, our numbers are not decreasing with regards to new HIV diagnosis. And specifically among Latinx gay bisexual men, most of the new diagnoses are among Latinx gay bisexual men. The bottom part of this chart is in those geographic areas specifically. And then the third and foremost portion of this graph is that there's still a lot of health disparities with regards to accessing services, HIV care and treatment services by Latinx community members. Because we believe in language justice, esta gráfica está en español. This graph is in Spanish, and it highlights also what we know currently in terms of what HIV looks like within trans Latinx and cisgender Latinx community members. Again, the 29% of the new diagnoses between 2009 2014 were among Latinx community members, and 15% among Latinx transgender males. In terms of women, 14% of the new diagnoses were among cisgender Latinx women. And it doesn't change in terms of access to HIV care and treatment. So this research that that I'm presenting now was gathered from a lot of different resources. What we know happens when ICE or when immigration attacks happen in immigrant communities. So this goes across the board. We know that there's a reduced engagement with health services. because there's fears of detention and deportation. In some community clinics, it's been reported that there's a 50% drop in accessing clinical services after an ICE raid, which continues for a full week. Again, disclosing immigration status has been linked to reducing likelihood of accessing services. And this is HIV specific, and in a little bit, I will go in deeper with COVID specific information. And it's associated with high rates of depression, anxiety, PTSD among immigrant communities. On top of that, there's HIV stigma and related experiences that result in secrecy that are further complicated by immigration status. Also, stigma, homophobia, and discrimination also limit or act as barriers to accessing services. So, in a nutshell, the barriers include the fear to deportation, work restrictions, inadequate interpretation and translation services, and difficulties meeting paperwork requirements. With regards to COVID-19 in immigrant communities, what we're hearing from folks on the ground is that there's a fear negative impacting on the new public charge rules. There's fear that there's going to be denial of services to immigration status, and fear detention and deportation. And actually, because I also am trained as a medical doctor, I've been assessing some calls where folks who are symptomatic are afraid to access services because of these concerns, or have been exposed and are not seeking health services. Just in the general community, there's housing insecurity, food insecurity. From a webinar that we participated and attended last week, hosted by HRC and LACOA, there's an increase in HIV testing and STI testing, an increase in incidence in both. There's increased survival sex, increased alcohol and cannabis use, and worries about hospital costs and burial costs, because most of the community members are not eligible for state and federal aid. In the midst of this pandemic, there's also a pending decision by the Supreme Court on DACA, which may impact the livelihood and the economic survival of 7,000 young immigrants. And not to mention what's happening in detention center. These numbers are specifically from the ICE webpage that is publicly available. And we know that there's more to be reported. Among detainees, we learned yesterday that it was the first confirmed death. There's 674 confirmed cases of COVID, and 1,343 have been tested. Among the staff, there's been 39 cases reported in detention centers, and in total, vice employees, 102 cases have been reported. So what can we do? It is our duty as community members, in whatever capacity we represent the community, to take a public stance against xenophobia and racism, and to advocate for adequate funding to Latinx, gay, and bisexual communities and Latinx organizations that have traditionally partnered with immigrant rights organizations. We need to assess the impact of immigrant attacks and changes to public charge on the effective implementation of Getting to Zero campaigns and ending the epidemic campaigns. We also need to take a public stance on the relationship that we have with ICE, making Know Your Rights information available to providers, clients, and community members. And as community activists, we need to continue to advocate on the behalf of those that not be able to speak out for fear of detention and deportation. And overall, we need to ask for just immigration reform, advocate to keep and expand DACA, and definitely to abolish ICE. These are some of the references that I pulled all the information from. And if you have other questions, please feel free to reach out to me at my email address. Thank you. Gracias. Back to you, Damian.
Thank you, Angel Fabian. Now we are gonna have a presentation by Oscar Lopez.
Can you hear me? It's Oscar.
Yes, we can hear you.
Okay, I'm going to try and make this presentation go. Okay, can you see there okay?
Yes.
Okay, and I have a little Chihuahua who has decided today to be extremely loud, so please forgive him. He is Mexican, so he has a lot to say, but please ignore him.
No
My name is Oscar Lopez. Some of you may know me from my old days at NMAC, then with the Valley AIDS Council, Latino Commission on AIDS. I now am the head of a small group, a nonprofit in the Rio Grande Valley on the border with Matamoros, Mexico. We call ourselves Poderosos, from the borderlands to Washington, D.C. And we are doing HIV awareness, PrEP promotion. We're not doing direct care, such as testing as of yet. But one of the things we have done, both as a representative of other organizations and now as my own representative, is raise funds to help the asylum seekers that are on the other side of our cities. The Rio Grande Valley here on the border has 14 bridges and one ferry that transport people back and forth across from Texas to Mexico, to Matamoros, Tamaulipas. The pictures you're seeing in front of you are the tent cities that were erected in Matamoros in a public park after there was an outcry from the citizens of Matamoros that they didn't want these folks in their community because they were basically living on the street. The U.S. Customs folks have now set up shop in the middle of the bridge right over the Rio Grande River to stop everyone who's an asylum seeker. They don't even let them onto the other side of the bridge like they've done the entire existence of our government. They stop them there, and if they're seeking asylum, they have them fill out some paperwork, and they tell them that a judge will see them within a year, and they send them back to Mexico. At that point, we, for example, have people from countries that don't speak Spanish, and they're made to wait along with everybody else in these makeshift tent cities. 3,000 tents are up right now. You can see some of them in the images, and some of them the tent city is not enough to hold the whole family, so people are making do as they can. They were not being fed, so we've raised money continuously, especially the LGBT community, some of the Catholic charity groups, to donate to volunteers who then cook the meal. We also go out and cook the meals ourselves, bag them, make them as nutritious as possible. They get fed at 6 in the morning and at 6 p.m. And I'll tell you more about how that's improved. But these are the living conditions of the asylum seekers waiting to be seen. In the past, up until recently, they would immediately cross over into the U.S., they'd be processed, they'd go before a judge. The judge would allow them to go to their families anywhere in the U.S. Those families would send bus tickets down to them, and they'd start their journey to Houston, to Philadelphia, New York, etc. 98% of all asylum seekers have always come back to their court hearings on time because they value what that means so much. But the new administration, or the not so new administration, has said that they don't trust that asylum seekers will show up, so they're making them wait in Mexico, which is ill-prepared to deal with them and is causing them to live basically in shantytown. The picture on the left is people lining up for food and for medical care. And as the picture on the right shows, we have infants, we have young children, we have people with HIV, we have large numbers of trans women who are escaping violence, human trafficking, and children also escaping human trafficking and violence and abuse done to them by coyotes. I personally had the I won't call it displeasure, but I was tasked with providing HIV positive results to 12-year-olds and 15-year-olds who are HIV positive because of the coyotes and the exploitation that happened. Most recently, in the last 5 months, a Global Response Management, which is an international medical program, has come in and set up small tents, almost as small as the ones that that the people live in, but they have now tested all 3,000 people living in the tent cities for COVID. They have not had one single positive result from all that testing. But they are finding measles, they are dealing with HIV and other illnesses. But once they identify what the illness is, they don't have the medications necessary to treat them. The good part of it is people are informed about what they have and they can seek care when and if they're able to get into the U.S. or unfortunately if they return back to their home countries. But they are being seen. If it's something acute, if it's malnutrition, it's addressed, wounds, things of that nature are taken care of. But anything more serious, unfortunately, the care is not there and available. Up until recently, about 3 months ago, volunteers and donors like myself and others have been giving money for others to cook and deliver the meals in sacks. Jose Andres, who I wish he was here, I would kiss his feet. Jose Andres and World Central Kitchen, well known for them showing up to provide hurricane relief, has set up now a tent cafeteria that will sit 2,000 people at a time. And they taught the volunteers how to cook meals for 2,000 to 3,000 people, because that's something we were not prepared for and we did not know how to do. The UN Human Rights Committee that visited Matamoros and the 10 cities said that it was the worst thing they'd ever seen, comparing it to worse than Syria and worse than any of the war zones that they've seen because of the lack of any kind of UN help, international aid, etc. And this is all caused because our current administration has decided that they do not trust these Latinos to come back for their asylum seeking hearings, even though everything proves otherwise. Also, if a child is unaccompanied or has been separated by their parents, even at 3 and 5 years of age, they're put before a judge to testify on their own behalf. A lawyer will be present and try to translate, but asking them questions like, why are they here? And why do they want to be in the U.S.? And do they have any family members? It is horrific to witness and horrific that it's happening. These are the immigrants walking to U.S. Homeland Security buses to be transferred to the Border Patrol facilities in McAllen and elsewhere. And as an example of how bad the conditions are, in May of 2019, there was an outbreak of the flu. There was a death of a 16-year-old Guatemalan child. So there was a temporary shutdown of the country's largest Border Patrol detention center. It completely shut down because of it. And the processing center identified 32 migrants with high fevers who were later quarantined. 5,200 adults have been identified with mumps and chickenpox. An outbreak of 39 detention centers. In December of this past year, they refused recommendations from CDC to provide flu vaccines to any of them. And a New York-based group that facilitates access to medical care for the immigrant children has visited all of these facilities on the U.S. border, on the U.S. side, including South Texas Family Residential Centers and others, and are finding that they're not doing enough other than basic inspections for chickenpox, lice. I've worked with some of them. I've helped them understand what it is to work with the trans community. And sadly, I can report that last year, when I explained to them what it means to be trans and that a trans young woman should not be separated from other women and isolated by herself because that brings on more bullying from the other children, They agreed. They integrated her into the young women's shelter facility. And when I went back a week later, they had cut off all her hair, cut off all her nails, taken away her makeup, and threw her in with the male youth instead, where unfortunately she was abused and molested. My PowerPoint is having trouble forwarding now. It is not moving. Okay, here we go. Let's see if you can hear this. I hope you can. Something has happened. Sorry, my apologies. Here we go. What we are finding since the COVID outbreak is that the young lawyers who are still providing legal advice and legal aid to the folks in the detention centers is that in small spaces, smaller than any of our living rooms most likely, we're still finding 30, 40 people all in the same spaces together. So it's a big concern for us that they're not taking any precautions to protect the folks in custody or the people who are detaining them. They're not providing masks. There's none of the germ fighting liquids to protect folks who are being detained or who are working there. And I wanted to just call again attention to what's happening in California with Latinos having the largest number of deaths and 19,000 plus cases of COVID in New York. Similarly, Latinos in New York City, 34% of the cases, 29% of the population. This right here, if you'll bear with me for a second.
Discovered in the course of witnessing here what's going on at the airport. This is the loading of human cargo for deportation. Buses that are loaded with humanity. Please, if you can wave back. The sadness that we see on those planes, the people walking up the stairs with shackles on them, will hurt you in a way that you've never hurt before. But they have to know we're wrong. They have to know that somebody out there sees this.
This is happening now 4 times a week. And it's largely women and infants being put on airplanes, but handcuffed and with foot shackles, being sent back to their home countries. And it's just deplorable. One of the things that my organization is doing, because what we were seeing is that Latinos, we are 89% Latinos in the Rio Grande Valley, where we have 1.2 million people. And we have a very large, now very mobilized gay community, thanks to our work to promote pride and address homophobia. But people are still sheltering in place with their grandmas, their tias, their children, their moms, multiple family members in small homes, because that's what our people can afford. We are one of the poorest cities and regions in the United States. But they're taking care of themselves at home. But many times the elderly who are stuck there have to be careful because their children work at Target and Walmart and Walgreens and restaurants. And so they're not only losing their jobs and losing income, but these young people come back in and have to be careful not to contaminate grandma. If that wasn't bad enough, unfortunately, our gay community has been addressing the loneliness that they feel, the isolation they feel, by jumping on the hookup apps at night and hooking up with strangers. And what we're asking them to do is there will be a time and a place for it, but it's not worth abuela's death to go get laid, to go get fucked. So you can see some of the images that we've created. No tengas relaciones sexuales ocasionales. No es el tiempo de andar buscando pitos. Buscar relaciones sexuales ocasionales no es no es distanciamiento social. And then he invertido demasiado para cagarla ahora, aimed at our trans community. Our trans community suffers a lot because they left homes where they were not allowed to identify as who they truly are, and now they're being forced to go back to these homes because of unemployment, etc., and are expressing a tremendous amount of depression, isolation, and one of the things that they can do is go online, be appreciated for who they are, but again, being put at risk for COVID as well as HIV. We don't do enough prep with this population. There needs to be more. It is sorely an underserved community. And with that, I will just say that those images in English and in Spanish are all available on our website at poderosos.org. Thank you very much for the time.
Thank you, Oscar Lopez, for that eye-opening presentation. And I hope that in the question section, we can address how people can get involved and be more active in pushing forward the struggle of immigrants in the US. And now I'm going to leave you with Ruby Corrado.
Hello, everyone. I'm not sure if you can see me. Something happened.
We can see you, but we can hear you.
Okay, so can you see my screen?
No, we can't.
Okay. Well, can you see if you can share my screen, please?
Chip, can you share her screen?
Okay. All right. Yes.
Now we can see you.
Okay, good.
Okay.
So hopefully if you can share my screen, that will be good as well. Well, my name is Ruby Corrado, and I am the founder and executive director of Casa Ruby. Casa Ruby is a community dream of immigrant, of marginalized people, sex workers, pretty much people that were never able to fit in the continuum of care in the United States. As a survivor of many life casualties, I had a dream that marginalized people could come together and we could create our own solutions to the issues that we were facing. Today, 27 plus years after that dream, there's an organization that caters and centers the needs of marginalized people, those who continue to live in societies where resources are very often not available to them, but we still, want to survive. Today, my focus has been on the survival of individuals that were already in vulnerable situations due to unemployment, having to live, on the streets, hungry, and then COVID hit. And I think that it is important to address the sense of urgency, because while the country is trying to focus on how they reopen societies and opportunities, there are people who have lost their lives and continue now to be in situations of survival. Since March the 10th, which is the day that Mayor Bowser, or the mayor of the District of Columbia, announced an emergency state for the city, our services have increased about 40% in the month of March and about 50% in the month of April. Just to give you an idea, on a given day, we will see approximately 100 individuals. Right now, we're seeing about 250 individuals on a daily basis. And that is due to the fact that when a lot of the guidelines were set up by CDC and the health departments, most people were told to go home. Most people said you have to quarantine yourself, you have to avoid socializing with other individuals. Well, unfortunately, there was no plan that included people that didn't have a home. It didn't include people that were unstable, and people that simply did not have the ability to keep themselves safe. So many of the individuals had to access shelter systems that were already putting LGBT populations at a disadvantage because they have never been inclusive, particularly under this administration. Basically, as a rapid response organization, as an organization that has a mission to uplift the lives of people who are already marginalized, we made the decision to continue to keep our doors open. Today, we are the only, and I quote, the only organization that continuously 24 hours has the doors open. People can come in and access housing services. People can come in and access food safety. Since, like I talked about the increase, in the month of March, we saw 800 clients. Now, most of those clients access between 5 and 10 services. So it has been a huge increase. Now, given that we are a rapid response organization, we were prepared. I have food for about 3 months. And a lot of our resources come from restaurants and hotels. So whenever they have additional supplies, they will call us. And unfortunately, we found ourselves not being able to access those supplies because those supporters have closed their doors. Today, with the very few resources that we have created a COVID relief fund that it's available to our clients, in which we have distributed about $20,000. And I think what I want to share with the audience is that most people who are in charge of developing policies, people who are in charge of making sure that they address crisis, very often do not have the voices of the people that need these services at advising them and telling them how we should respond. I think most people were caught by surprise, how to deal with this situation. But as a result of that, marginalized and vulnerable populations, were left without anything. And when I say anything, we have HIV positive LGBTQ people in big cities that were not part of the plan. So now when we are telling people that they are at high risk, cities like Washington, D.C. was not able to accommodate the needs of people who were HIV positive. And a lot of the clinics and the clinical services closed the door. They said, well, you know what, we're gonna do our work, telework. You can call this number and you can come back when we open the doors. Well, the truth is, when you are a person who has no resources, you may not even have access to a phone. You may not even have access to money to pay for that phone that will communicate you with the support that you need. So I feel that the system was already broken because it did not center the lives of people who have special needs, and especially now, left a lot of people with really nothing. As an organization that continues to respond to this epidemic, we are doing everything that we can. Certainly, I have staff. I have lots of volunteers from the community. But one of the things that everybody talked about as essential personnel that we became because when you are the only facility in a city providing these type of services to vulnerable populations, you have the high risk of being exposed. You know, when you have 800 people walking through your doors, there's the likelihood that one of them will bring COVID-19. So it was very stressful at the beginning because we were trying to navigate, you know, how do we keep everyone safe at a time where the resources were not going to come to us. You know, when we have all these plans, the emergency plans, none of them included marginalized communities, even in the settings of housing, in the settings of public health. And what we do is we end up, you know, with organizations that really have to stretch very, very, very thin the resources that we have. I think it's very important that this conversation that continues, particularly when we talk about what does it look like to reopen the country. You know, what does it look like now where the people who were in need were left behind? And how do we go back and support those individuals and organizations that did not go away? I have a network of trans-led organizations, immigrant-led organizations across the country where they are actually handling this epidemic on their own. There are people in New York City who actually went into their own kitchens and said, well, there's no food, we're going to prepare food to give to our communities, when they were already vulnerable. We have people and activists actually begging in food banks so we can prepare meals to the people in our communities. And I think that, you know, one of the things that I am really taken by is that, particularly in the LGBTQ community, we have national organizations. We have a huge LGBTQ movement in this country that just celebrated Stonewall with huge celebrations, and billions of dollars were spent across the country. Yet, none of those national organizations reached out to the people on the ground and say, how are you doing? How are you guys doing? You know, did you eat? Did you have the ability, you know, to continue to be safe? And that is very sad because many of us who put our lives on the line are not here. I want to take a moment to remember Lorena Borjas. Lorena Borjas is one of the fiercest community activists across this country. And unfortunately, due to the systems not centering our leadership, she succumbed to COVID-19. And what it has done, it has really awakened this sense of how much we need to come together, because at the end of the day, we continue to be populations, we continue to be people that are not centered. I saw through the emails that I received some of the initiatives that said we have rapid response funds. You know, there's one big AIDS funder who this month sent a proposal. You know, we want to hear from people. And we already knew that we were not going to get those funds because we don't get them anyway when there's no COVID-19. So, but you know, we still tried and continue to get our denial. So I want to focus on the conversation that today there are people who will continue and be able to go back to work. There are people who will continue to do this work. And I want to make a call of action for them to center the work that is being done right now. We need to become partners if we are going to keep our communities safe.
Thank you, Ruby. And okay, now, thank you, Ruby. Thanks a lot. I wanted to follow up on that, on what you were saying about taking action, because I believe that throughout the three presentations, you have all given us a hint on things that we can do, on donating money, on volunteering, obviously social media, partnering with other organizations. But I also want you to give us an idea of what people can do at the state level or with the public health department on their state. What are the more specific actions that people can do to support all of you?
Mhm. Okay. Well, if I am allowed to speak, I want to say that number one is we must focus on our leadership. I think the Latino community right now is one of those communities that currently lacks a national presence in where spaces be made. And I think a lot of that is because the system in which we all navigate does not allow for us to really come together. That I think it's essential. I do keep communication with a lot of the activists around the country, but that is pretty much on a friendship basis. I think many of us are very capable of influencing policy, influencing change, but I think the system in which we navigate doesn't even, allow us to know who we are and what we're doing. Number two, I think it's important to tell our stories. Very often, one of the reasons why people go without access is because people don't know that we exist and that we continue to struggle. And at a time where COVID-19 put a reality of what it's like to go without, this is the best time for people who never lost a paycheck, the people who continue to receive a stimulus that they did not need, to be aware of who are the people in our communities that are definitely going without, who are the people that cannot even go to a safe space because they are being discriminated for being undocumented and being transgender. And this is the opportunity to show those who have access to that power, to have access to the resources, to have an opportunity to know the stories. I did a story in Washington Post, and that's because I have a long history in Washington, D.C., and they followed us for 2 weeks. When that report came out, very few entities picked it up. You will think that, as we have CNN, we have all these big networks talking about, how do we address this? We have gay reporters not even covering our own stories. And I think if our stories do not get out, if people do not know the tragedy that immigrants communities are living, nothing will happen because it appears like nothing is happening right now.
Oscar and Angel, would you like to add something to that?
Yes.
You-
Can you hear me okay?
Yes.
Okay, because I've lost the visual, but one of the things that we are very concerned about in our region, but I think the same can be said of other parts of the U.S. where we have chicken farms and where we have the beef processing plants and the pork processing plants. You hear it on the news now daily because all of a sudden there's not enough fajitas to go around for people. But the folks who are still working in these facilities are not being protected appropriately, sufficiently. And the only reason that now shields and other things are being provided to them is because somebody who wants to barbecue on Sunday in Arizona for 10,000 people doesn't have enough meat. The reality is that essential workers, from farm workers, the ones that are working in the fields, to bus drivers, healthcare workers, all the frontline folks of this pandemic, but especially like the bus drivers and folks who you don't think about in terms of have a lot of access to people, but they don't have the protections. The safety standards aren't there. The job protections aren't in place. And we all have a responsibility to provide these workers with the protections they need. Every night we hear about the doctors and nurses, and God bless each and every single one of them, but we have to look at the essential frontline staff that are putting food on our tables, that are stocking our shelves, that are checking us out at the grocery store, working their asses off, and not only not being compensated fairly, but they're not being protected by these huge corporations that are going to be, that have been benefiting from our insistence on stocking up on bleach and toilet paper, etc. Right now, Representative Ro Kahana has a letter she's asking for other representatives to sign on. It's an Essential Workers Bill of Rights. Please, all you have to do is Google Ro Kahana, R-O, Kahana is K-H-A-N-N-A, Ro Kahana. And again, it's the letter of support for Essential Workers Bill of Rights. Ask your local representative to get off their ass and sign on to it, please.
And I would echo both Ruby and Oscar on some of what they shared, but I also wanted to center language justice in this conversation as well, because I think at the federal, state, and local level, some folks have approached me in other webinars and said, well, how do we get folks involved? Well, folks cannot get involved if they don't speak the language. If you don't make the meetings accessible by having competent interpretation and translation services available for folks to be able to really engage in the processes that we're wanting to engage them in. I mean, folks have an opinion, and like Ruby said, we have our stories to share, but sometimes we cannot share them. And I wanted to also expand that to language justice is not only Spanish to English. It's, when some of the big ice raids happened in some of the meat packing farms or industry, those individuals spoke an indigenous language from Central America. So even access to be able to provide legal support for them was almost impossible. So we really have to think outside the box, especially now because the inequities are really, really coming up, being very apparent to all of us.
Yeah. I know that our time is almost.
Sorry.
I'm sorry,
Can I say
Oscar?
one more thing? Yeah, and that is that if our president is correct and we all inject bleach into ourselves and we're all cured from this soon, the focus will go back to what's happening on the border. But it can't happen soon enough because how our immigrants are being treated, the detention centers that they're being held in, the separation of children that is still happening, the mass deportations, the not giving them their due rights to a hearing, the amount of women, especially trans Latinas, that are coming into this country to escape sex trafficking, the violence, the rape, and yet being sent back to be murdered, is beyond belief. So I know right now COVID is very much has our attention, but there hopefully will be a pause in the summer. During that pause, if not sooner, we need to get re-energized around the asylum seekers, because they are not coming here because they don't want to be in their countries. They're coming here because of food scarcity, because of drought, because the poverty is so horrific they cannot feed their children. And if they think that living in a plastic tent city with 2 meals a day provided by this global fund program is better than home, you can only imagine what home is like. So please, we cannot forget about them.
I know that our time is up, but still, I wanted to get some questions from the people. Chip, are there any questions?
Yeah, can you hear me fine?
Yes.
Okay, so we have several questions actually. First one is, there is no support for people that go out from detention centers to get access to HIV care since many community health centers are not open for new patients. Do you know any HIV medication banks?
Can I?
Yeah.
one of the Yes, one of the resources that we have been utilizing, many of the local health departments are trying to really push for PrEP, trying to push for people to be involving in care. And particularly here in Washington, D.C., we do have a wellness center that is still open by appointment, and where clients who are undocumented, who don't have health insurance, can have a letter from the local shelter and still be able to access their medication. We have clients last week that we were able to connect. So I would say that if your local health department does have care engagement, which is most people who are not in care, that will be a good resource to actually access.
Thank you. One more question, Chip?
Sure. I had a question here from someone. It's not really a question, it's a broad question, but want to know about HIV and heterosexual men in this community.
Is that the question?
Yes, it's just someone who said that someone who's identifying as HIV and a heterosexual man and wants to know what is going on in that community as well.
Okay, well, this is Oscar. The challenge for that question and not knowing more is, for me, is how to address it. But I'll tell you what we're seeing, which is heterosexual men aren't being offered routine testing as much as the LGBTQ community because they're seen as being at lower risk or at no risk. Not taking into account those men who are on the down low or who are bisexual. The problems that we're seeing also, though, is that because HIV stigma is still so much tied to homophobia, that those men who are heterosexual and Latino and immigrants who are testing positive have a very difficult time telling their families, telling their spouses. So we're still seeing transmissions to their wives, and those same wives then having HIV positive children. And it's not always because the man is closeted and queer but doesn't know how to deal with it. It's that the services haven't been there, the counseling isn't being made available, and then the entire family is suffering for it.
I think similar to what has happened in other communities, I think the data collection is not there yet. And so I think that we have data for Latinx, straight identified or heterosexually identified men who use drugs, and data around that. But in terms of just general data, we don't have. I mean, there's a lack of data collection also in the Trans-Latina community. And so I think that again, if we're thinking of solutions, those investments have to be very intentional around what is truly happening within our communities.
Yeah. So for the sake of time, can we have just one more question from the chat box, Chip?
Sure, 1 second here.
The pressure on him is to make it a really good one.
Let's see. Many big organizations that are giving rapid response funds are blocking the funds because we are supporting undocumented immigrants. Do you have any resources for undocumented immigrants?
That's a hard one because the undocumented immigrants are scared to come in for services. In many cities, our brothers and sisters at ASOs are reporting that ICE agents, Border Patrol will park nearby to deter people from coming in. They've all heard the rhetoric that if you access federal funding programs, it's going to affect the asylum seeking, the access to citizenship for somebody else in the family, not just the patient. But gosh, a really difficult one. I don't know if the other two panelists have an answer.
The question, could you repeat the question again?
Sure, one second now. Many big organizations are giving rapid response funds or blocking the funds because we are supporting undocumented immigrants. Do you have any resources for undocumented immigrants?
You know, the beauty of our community is the fact that we work sometimes on underground economies. And those underground economies have been able to get activated. And I've seen, and you could see it on social media, that mutual aid has been such a powerful tool to be able to provide help with rent, help with bills, help with food. And so I think that I would encourage everyone to look into their local communities. If you're not a Facebook fan, get over it. If you're not, because that's how people are connecting, and that's how people are finding ways to support one another.
I want to say, obviously, this is a question that if you ask the hundreds of organizers, the hundreds of leaders that are working very hard in their communities right now, they will tell you they're not existent. To the very few organizations that have evolved in the last 25 years, like Casa Ruby, Trans Latina Coalition, Ariana Center in Florida, Casa Andrea in Texas, the Trans Latina Network in New York City, many of us were like the Paycheck Protection Plan. The very little money that came in, which most of the grants that were awarded were around $3,000, is gone. It's gone. Now, what I am very aware of is that in most local communities, there are movements very often led by cisgender, heterosexual people that are talking about immigration, that are talking about HIV, that are talking about a response to how do we move forward after COVID, and never included queer voices. In the District of Columbia, we have a group, Sanctuary DMV. They have raised almost $1 million, and they're on their way to raise $1 million. And it is all funded by lots of people who gave their stimulus check, and not one penny that I am aware of went to queer communities. And this is something that is replicated in a lot of the progressive areas where there's a lot of money being raised. There's a lot of things, there are plans. You have all these queer people who happen to be people of color who never even mention the work that is happening in our own communities. So my advice is to circulate our stories, because many of us lost their lives fighting not only HIV, but now this monster in a system that already didn't provide us any safety networks. And it is imperative that we as leaders call on the people to make changes. The funders will be ashamed to put COVID relief proposals and not give them to the people that are struggling, the people that are currently in need, that currently don't have a lot, and that probably will not get anything once this country goes back to normal.
Well,
I would also add really quickly that for all of us, all the queer men especially who are on PrEP like I am, when we access PrEP through an ASO, most of those ASOs are set up to benefit upwards of $900 per prescription every time we get a refill. We have to be asking, how is that money used? Yes, the money belongs to the ASO, but how flexible is it? I know there's restrictions, but can it be used to help those most in need, to provide medications, to provide services? That money will be going away within a year as things go to generic. But in the meantime, while it's there, agencies are pulling in millions of dollars, and that money needs to be sent right back into the community that is giving it to them.
Totally. I wish we had more time to continue this conversation. I think it speaks about the importance of having and keeping this conversation. And I want to thank the presenters for your time. I hope this webinar can spark many other conversations to keep talking about immigration alive. I want to let everyone know that keep an eye on the newsletter of the upcoming weeks. We are planning a webinar that will be completely in Spanish with resources for immigrants who are Spanish speaking. So thank you, everyone, and have a great day. Thank you.
Thank you.
Thank you, Damian.
Take care. Buenas tardes.